Hi, I'm Dr. Eric Balcavage. I want to thank you for coming to my site on fibromyalgia. If you found this site, you or someone you know is suffering with fibromyalgia and you know how disabling a disorder this can be. But I want to let you know that we've been helping people with fibromyalgia for years. And I also want to tell you, and maybe something that may be shocking to you, that fibromyalgia is not being treated properly. It is not a musculoskeletal disorder, which so many people are treating it as if it is. Fibromyalgia is more of a metabolic and neurologic disorder, and there's plenty of research that's coming out now to show that. The biggest challenge with fibromyalgia is that it really isn't a disease in itself. It's an accumulation of symptoms. And what we've named is we've taken all those symptoms and people that fall into this pot and put a name to it. And that's okay, but just because you have the label of fibromyalgia as a disorder, it doesn't tell us what's wrong with you. And that's really what we need to find. If anybody's going to help you get better, we've got to stop treating your individual symptoms, and we've got to start finding the underlying cause of what's creating the symptoms. Now, as you know, if you're suffering with fibromyalgia, you've probably been to multiple doctors. I think I've seen patients that have been to 20+ doctors for their fibromyalgia, and unfortunately they haven't had a solution. Once they come into our practice, it's a whole new ball game for them, because I understand that they have their fibromyalgia. I want to know all about your symptoms, your conditions, but I also really want to get to the root cause. And fibromyalgia is a complicated bug, man. It is a complicated disorder because there's so many possibilities of what may be causing challenges. Evidence is showing that the brains of people with fibromyalgia just aren't working right. So they have neurologic breakdown. We also know that metabolically there's a lot of problems with people who have fibromyalgia. And those problems could range from, besides the neurologic issues, they could range from nutritional deficiencies, food sensitivities, blood sugar imbalances, adrenal imbalances, thyroid disorders, hormone imbalances, immune system challenges, and the list goes on. And so what's happening with people who suffer with fibromyalgia, especially in today's medical model, is that they're going from specialist to specialist to specialist, and they're only identifying their little piece. And since fibromyalgia can be a multi-system disorder, and most commonly is, you need to go to somebody who can manage the whole you, the whole condition. And this is one of the things that makes us different. I don't want to treat your diagnosis. I want to treat you. I want to find out what's wrong with you. Because if 10 people come into my practice who have fibromyalgia, just because they have the same diagnosis doesn't mean they arrive at their current state for the same reasons. It may be, each person may have different causes for their symptomatology, which is what we often find. And so you can't just treat everybody the same. It just doesn't make sense. So what makes us different is that we really, within our practice, evaluate the whole you. We evaluate you neurologically. We're going to evaluate you metabolically. We're going to evaluate you structurally. And once we've done all that evaluation, we can put all those pieces together to formulate a treatment program to not treat the fibromyalgia, but to treat the underlying causes of the fibromyalgia so that you actually get better. If you've been suffering from fibromyalgia for some time now, some people have tried to treat your symptoms and it hasn't helped, or you wouldn't be looking for this video or for this page. So if you've got an interest in finding out what we can do to help you, if you're a candidate for care in our practice, fill out the information request. And when you do, I'll send you a DVD that explains the procedures that we use in my practice, and we'll also send you a report that kind of goes a little bit in depth with what's on the DVD, kind of a follow along. Also in that package, I'll send you an information pack. If you decide that this sounds like what you want to find out, if our practice is right for you, you'll have a packet of information to fill out and some instructions of things to do once you've watched the DVD. So fill out the information. I hope to hear from you soon. If you have any questions, you can always contact my office or shoot me an email, and I'll be more than happy to get back to you. All right? Take care.